As you know, the NCIS group in the intensive care nursery has been working very hard to promote hand hygiene in our nursery. We would like you to watch this video and identify all the missed opportunities for hand hygiene that you see.
Hey, good morning, Lisa.
Hey, Gary.
Hey, they called and said the baby needs suctioning.
Yeah, he does.
Yeah. See you later.
All right, thanks, Gary.
Okay. Okay, Lisa.
All right, thanks.
Okay, bye.
Hi, Lisa.
Hey, Sarah. Bless you.
Thanks. I'd like to examine this baby now, okay?
Oh, okay.
Great, thanks. She looks great, thanks, Lisa.
All right, great. Thanks. All right, thank you.
Lisa, you
Yeah?
have a phone call on 56. I believe it's your daughter.
All right, thank you.
Thank you.
Can I call you back in a few minutes? I'm busy. All right, bye.
Hand hygiene is important not just in the ICN, but in all healthcare settings. Microorganisms are transmitted by the hands of healthcare workers because whenever a healthcare worker touches a surface or the patient's surroundings or the patient, their hands pick up microorganisms from the surface that they just touched. And when they touch another surface without cleaning their hands in between, the microorganisms are donated to the new surface. So when performing hand hygiene, you're trying to interrupt this transfer of microorganisms from one patient to another or from another surface to a patient, preventing transmission of organisms from a dirty area of a patient's body to a clean site, and preventing colonization and infection of healthcare workers and their families. Newborns in the intensive care nursery are probably the most fragile of all the patients in the hospital because they have multiple invasive devices in their bodies, and also they need to be handled, examined, and managed frequently. Most healthcare workers have to realize that their hands, while they like to think of them as healing hands, and they are healing hands in most circumstances, they can also hurt patients if they don't realize what they're picking up from one surface and transferring to another surface. For a long time, doctors, nurses, and other healthcare workers in intensive care nurseries used to think that getting an infection was just part of nursery care. And in fact, many times when they talked to parents and explained the potential complications, they would throw in infection as a possible complication, almost as if it was a rite of passage, and that every baby was entitled to an infection. But in the last decade or so, there has been an increasing recognition that infections are not an entitlement of babies, but they are a preventable complication. And in fact, they are a type of medical error that should be prevented and that should not be tolerated as something that just happens. And I think that shift in the mental model has been responsible for a heightened awareness of the need to prevent infections and perform hand hygiene. I know of several neonatal intensive care units across the country where they have gone for a year or two without having an infection. The NCIS group has been working in the intensive care nursery for a long time now, and we have defined something called the nest. We define the nest as consisting of the baby with all the equipment that is attached to or belongs to the baby, like the incubator, the monitor, the countertop, the ventilator, the drawers under the incubator. So understanding the concept of the nest can really help us clearly identify what are the opportunities for hand hygiene. Before entering the nest, inside the nest, before handling any invasive device, inside the nest after handling a dirty area, and then when leaving the nest. It's important to remember that even if you touch a baby's incubator or a ventilator and you haven't touched the baby, you have still touched a part of the nest. So you still have to clean your hands before moving on. Otherwise, you could carry organisms from that ventilator surface or the monitor surface to another baby. The first step is to prepare your hands. Every nurse or doctor who handles patients should have their arms bare from the elbows down. Next, remove any jewelry, wristwatches or bracelets. Staff should also not have any false nails. After that, dispense enough hand sanitizing foam or gel to cover the entire surface of both hands. Rub your palms together, interlacing your fingers with the palms together. Cover each thumb and the space between the thumb and index finger, and then the wrists. And then, finally, followed by the tips of the fingers by rubbing them onto the palm of the other hand. After doing all these movements, when the alcohol gel or foam has dried, then your hands are clean. So with that simple technique practiced habitually, infections can be significantly reduced. We're going to now replay the earlier video and identify how to correctly perform hand hygiene in the intensive care nursery. In this video, as you can see, Lisa brought a can of almonds to the computer on wheels, and that's a strict no-no. We should not be bringing any food to the patient care areas. And you can see her adjusting her hair, touching her nose, and then touching the computer keyboard. And these are things we commonly do as healthcare workers. While this is greatly exaggerated, it clearly shows how lapses in hand hygiene happen on a daily basis. Let's make some adjustments and watch the same scene with corrected behavior. In this video, you can see Lisa placing her food in a non-patient care area, which is how it should be done. She cleans her hands before entering the main part of the intensive care nursery. She touches her hair and her glasses, puts her hair up. Having highlighted the opportunities for hand hygiene up to this point, let's continue to identify more missed opportunities. Now she hears a monitor going off. She touches the monitor and silences it without performing hand hygiene. Then she picks up the syringe without performing hand hygiene. The syringe falls on the floor. She picks it up. I told you this was a little over the top. And that's a missed opportunity for hand hygiene. She opens the incubator door without performing hand hygiene. That's another missed opportunity. She just touched her glasses. Here's a respiratory therapist, Gary, coming in, and he heads straight to the incubator without cleaning his hands. That's another missed opportunity.
See you later.
All right, thanks, Gary.
Again, this is an exaggerated scenario, but curiously not too far-fetched. We can easily correct the problem by knowing exactly how to identify a hand hygiene opportunity. Before going to the bedside and entering the baby's nest, she performs hand hygiene and then silences the alarm, which is the right way to do it. She has to give this baby a medication. She performs her hand hygiene again, notices the syringe fall on the floor, leaves it there, and picks out a new syringe, which is what she should do. Cleans the hub, and then loads the new syringe into the infusion pump. She's already in the nest, so she doesn't need to clean her hands while opening the incubator door. She handles the baby.
Good morning, Lisa.
Gary, the respiratory therapist, arrives and correctly cleans his hands before even touching the incubator door. So he just entered the nest, but after cleaning his hands. That's moment one. Lisa is just about to leave the nest.
All right, thanks, Gary.
She touched her hair, and then she has entered another baby's nest, but she cleans her hands before that. She's going to change a diaper, so she puts on gloves. She changes this baby's diaper, and this is an opportunity for hand hygiene.
Okay, Lisa. Thank you.
All right, thanks.
Okay, bye.
And you can see Gary cleaning his hands as he leaves the nest of that baby. Meanwhile, Lisa has just finished changing the diaper. She dumps the diaper in the trash, takes off her gloves, and then performs hand hygiene like she should. Then she has to get a blood sample. So she puts on gloves. In the previous video, she did not have gloves on when she was drawing blood.
Hi, Lisa.
Sarah, the nurse
I'm here to
practitioner,
examine
now
the
is at the
baby.
bedside.
Okay. Oh, you may want to wear a mask.
Okay, thank you.
When Lisa noticed Sarah sneezing, she gave Sarah a friendly reminder that she should wear a mask, and Sarah graciously accepts the reminder. Notice that Sarah has placed her portfolio on a counter outside of the baby's nest. If you recall, in the previous version, she placed her portfolio on the counter next to the crib, and that's a big no-no. She cleans her hand, then puts on a mask appropriately because she just sneezed. So she doesn't want to transmit organisms to this baby. Cleans her hands again as she enters the nest. She also makes sure her hands are dry from the sanitizing foam before handling the baby. Auscultates. Then when she's done and she's
She looks
about to
great.
leave the nest,
Okay, thanks.
Thank you.
she cleans her hands again. Lisa, again entering the nest, cleans her hands.
Lisa, you have
Yeah?
a phone call on 56. I believe it's your daughter.
Sure, thank you.
Sheila tells Lisa that she has a phone call, but before she leaves the nest, she cleans her hands again. That's excellent. She answers the
Can
phone.
I call you back in a few minutes? Okay, thanks.
Then she's going to the other baby's nest now. She cleans her hands. You can see she's scrubbing her hands thoroughly, covering all the surfaces. Silences the infusion pump. As she left the nest, you noticed she cleaned her hands again before she went to the computer on wheels. Note that the can of almonds is missing from the computer on wheels. If each one of us practices hand hygiene scrupulously at every opportunity, we can definitely achieve our goal of eliminating healthcare associated infections from the intensive care nursery.